come in.
Hello.
Hello, I'm Jodie. I'm the nurse practitioner, and you're Mr. Garland. How would you like to be addressed today?
Alex is fine, thanks.
Okay, that's good. Now, for me to be able to help you today, I would like to take a history that will involve me asking you some questions about your health and your social circumstances. Is that okay with you?
Yeah, that's fine.
Now, before we start, I'd just like to confirm your details are correct. So you are Alexander Garland, and you're 49 years old, and is this your current address?
Yes, that is.
Great, that's good. So, Alex, what brings you here today?
Well, I've had a cough for a few days and it's just been driving me nuts, really.
Okay, so how long has the cough been there?
It's been about 3 or 4 days.
So, have you had any other symptoms with that cough?
I've got a bit of a sore throat as well, and that really hurts.
Okay, so has the sore throat been at the same time as the cough?
Yes, both started about the same time.
So, the cough and the sore throat, are they worse at any particular time of the day or night?
Well, the cough is worse in the mornings, especially when I get up, and the sore throat is there all the time.
Are you able to swallow with that sore throat?
Yes, I can drink and eat.
Right, can you describe the cough for me?
It's dry and I've not coughing up anything. It feels like there is something there, but it's just not moving.
Okay. When you're coughing, you said there wasn't any phlegm or anything. Have you noticed any blood when you cough?
No blood. It does hurt in my chest though.
Okay, on a scale of 1 to 10, how bad is that cough for you? 1 being not too bad, and 10 being the worst cough you've ever had.
It's probably about a 6 or a 7 really, possibly an 8 at times.
You mentioned that it was painful to cough. Where exactly is the pain? Is it in your chest or throat?
It's mainly on my chest and my throat is a bit sore when I cough.
Fine. When you cough, does the pain radiate anywhere else in your body?
Yes, sometimes it hurts in my back and my armpits.
Okay. So has anyone else in your family or where you live had any similar symptoms? Have you noticed anyone coughing around you?
Well, my girlfriend just came back from visiting her sister in Italy and she's had a cough for a week now, but she's had to be off work sick. She's been really warm and we thought it might have been because of the sunburn. She was out in the sun a lot.
Okay, so you didn't travel with her?
No, I had a lot of work on at the moment.
Fine. Has anyone in the place you live travelled abroad in the last few weeks?
No, just us two. It's just my girlfriend and myself.
Okay, thank you. Now your cough, does anything make it easier?
I find that sitting up makes it easier to breathe, so I've been propping myself up with pillows.
Okay, that's fine, thank you. I want to ask you some more specific questions. You said you hadn't had any blood in your phlegm. Now, have you been feeling shivery or had a fever?
I've been a bit warm. I was bad last night, that's why I've come to see you today.
Okay. Now, you said sitting up is making your breathing easier. Are you feeling generally breathless?
Yes, when I climb the stairs, and I've stopped going out for a run as well.
Thank you, Alex. Now I'm going to be looking at your overall health. Do you get headaches at all?
Sometimes, about once a month or so.
Do you take any medication for that, or have you seen a doctor before?
No, well, just over-the-counter stuff. Paracetamol, that sort of thing.
Have you had your eyesight checked recently? Do you wear glasses?
No, I don't wear glasses.
So your eyesight is good. Do you have any problems with your sinuses, nasal congestion at all?
Cats set me off. They make me sneeze if I'm around them. I think I'm allergic to them.
Yes, that does sound possible. Now, have you had any problems with your taste recently? Any changes in your mouth at all?
No, nothing.
Do you get mouth ulcers?
Occasionally, nothing I worry about. I get cold sores sometimes when I'm overtired. I seem to get them, but I have some stuff from the chemist I use on them.
Okay. You have a sore throat now. Do you get recurrent sore throats?
No, just if I get a cold or something like that.
Have you had any problems with your chest or your heart?
No, nothing like that.
And your bowels, they're fine? Any problems?
Yes, all fine.
Good. Water works okay. Any
Yeah.
problems passing urine?
Yeah, all fine, all good.
Good. Excuse me, I have to ask a bit more probing questions about your sexual health. You said you're in a relationship. You mentioned a girlfriend.
Yes, I have a girlfriend. We've been together for about 5 years now.
So would you consider yourself to be heterosexual?
Oh, yes.
Okay, thank you for answering those questions. Now, may I just ask, are you using any form of contraception with your girlfriend?
She is on the pill.
And you said it's a long-term relationship.
Yes, 5 years.
Okay, thank you. What about your bones? Any aches or pains?
Only if I've been busy at work, just minor aches and pains then.
Good. So how have you been feeling in yourself? Would you say that you're in a positive mood?
Well, I've been feeling a bit down, but that's just with being ill, but usually I'm okay.
Good. So a little bit about your surgical history. Have you had any operations?
I had my appendix out when I was a kid, but nothing else.
And that was okay afterwards? No other complications?
Nothing else.
And no other operations apart from that?
No.
Now, I'm just looking at your wider health history. Have you, or any of your family, that's mum, dad, siblings, brothers and sisters, had any medical conditions such as jaundice, anemia, which is iron deficiency, or any heart problems such as a heart attack?
No, we're all quite a healthy bunch.
Okay, how about TB? No thyroid problems?
No, nothing.
Rheumatic fever or rheumatism?
No.
Any high blood pressure in the family?
I have got high blood pressure myself.
Oh, okay. So when was that diagnosed, and are you taking any treatment for that?
I'm taking amlodipine, and it was about 2 years ago.
Okay, thanks. And is it well controlled?
Yes, I go for a checkup with my GP and I have a medication review every year.
When was your blood pressure last checked?
About 2 weeks ago, and it was okay.
Good. And what about diabetes?
Yes, I'm diabetic as well.
Do you know what type it is?
I take tablets for it.
And when were you diagnosed with diabetes?
Must have been about 5 years ago now.
And your last checkup?
The same time I had my blood pressure done with the GP.
Was it
Yes.
okay?
Yes, all okay.
Okay. So any strokes, asthma, either you or your family?
No,
Any cancers at all?
no, nothing like that.
I know you said you take medication for high blood pressure and diabetes. Do you take any other medication or tablets?
No, nothing.
Do you have any allergies that you know of? Any foods or medication?
Nothing except cats, but I haven't been told that. I just get sneezy around them.
Okay, so possibly an environmental allergy, but nothing else?
No.
Do you take any non-prescribed or recreational drugs at all?
Oh, no, definitely not.
Okay, thank you. Any over-the-counter medication? You said you had cold sores earlier.
Yes, just that cream stuff for cold sores.
It's a Virax.
Yeah, that's the one.
Good. Anything else?
I had some ibuprofen from a sore throat. It helped a bit.
Do you take any herbal remedies?
No, I don't believe in that rubbish.
Okay, so a little bit more about your social areas. What is your occupation?
I'm a builder.
Have you been exposed to any new substances or excessive dust recently at work?
No, nothing unusual, just normal working.
Okay, so you said you have a girlfriend and you live together?
Yes.
So how is home? Any stresses? Everything happy at home?
Yes, no problems at all.
So do you live in a house or a flat?
We live in a flat.
And you're a homeowner?
Yes.
Can I ask you, do you smoke at all?
No, I gave it up 2 years ago though. Vape occasionally now, but just when I go to the pub.
Oh, and alcohol. You mentioned the pub.
Only a couple of pints on a Saturday night, and sometimes me and the missus share a bottle of red during the week.
Okay, that's fine, thank you. And your diet, do you eat well?
Yes, my girlfriend's a really good cook and she started me on some good quality food.
Good. And do you exercise at all?
I like to go for a run now and then, and I have a physical job, so I'm always lifting and outside a lot.
That's good, because exercise and a good diet will be beneficial given your high blood pressure and diabetes. Now, Alex, I'm just going to sum up everything you've told me. Please correct me if I'm wrong. You've had the cough, which you said was painful, and a sore throat for about 3 or 4 days. You started to get hot or feverish, and that's when you decided to come in. You haven't been coughing anything up, and you've been taking some ibuprofen over the last few days. Your breathing has been a bit restricted, and you have type 2 diabetes. That's what you take your tablets for. But it's well controlled, and so is your blood pressure. You live with your long-term girlfriend and work is good, your mood is positive, and you just want us to sort out your cough and sore throat. Is there anything else that you want to add to that before we move on?
No, that's everything.
Thank you, Alex. Now what I have to do is to check some vital signs, and we will recheck your blood pressure. I may have to take some mouth swabs and some other tests such as your temperature. Is that okay?
Yeah, that's fine.